Hi, I'm Michelle Ruggeroni, and I probably wouldn't have been able to have done this 3 years ago. I had really bad knees. They were very, very painful. I couldn't go downstairs. I could get upstairs, but then I couldn't go downstairs. I couldn't do very much, to be honest. Walking with my family was impossible. At the age of 50, you want to be able to do lots of things, but I'd managed to wear out my knees from always being on the heavy side, and it's just one of those things. So I went to see Mr. Thomas Boerger, who reassured me that something could be done, that my life could be given back to me, and that I would benefit from a bilateral partial knee replacement. Now you hear those words and you think, oh my gosh, how am I going to put up with that? But actually, it's exactly what happened. I had my operation. I was as fit as I could be before the op. I managed to lose 10 kilos, which is the first thing Mr. Boerger told me. He doesn't mince his words, and I prefer that because at least I know where I stand. He asked me to lose a bit of weight, to get as fit as I could, which is exactly what I did. So my operation was a success. I had an epidural, which was fine because I didn't remember anything. I was out most of the operation, and then the recovery was a little arduous. I can't deny it. It was very painful for about 5 days after the op, with swelling and all the rest, normal procedure after an operation. But I did exactly what Mr. Boerger told me to do. I went through every single step. I walked when I should have walked. I sat when I should have sat. And thank goodness my recovery is fantastic. This is a year later. I'm now cycling, swimming, walking, and my knees don't hurt at all. In fact, I forget I have implants in there. So if anybody's thinking about having a bilateral partial knee replacement, Mr. Boerger's your man. I wouldn't recommend anybody else.